Welcome to our video on GERD, also known as acid reflux. Today, we'll explore the early warning signs that can help you spot this condition before it becomes more severe. GERD stands for gastroesophageal reflux disease, a common digestive disorder where stomach acid flows back into the esophagus. This can cause discomfort and, if left untreated, lead to complications. Recognizing the early symptoms is crucial for timely intervention and better health outcomes. Let's start by understanding what GERD is and why it's important to pay attention to its warning signs. GERD is caused by a malfunction of the lower esophageal sphincter, which acts as a gate between your stomach and esophagus. When this muscle weakens or relaxes inappropriately, stomach acid can escape into the esophagus, leading to irritation. Factors such as obesity, certain foods, smoking, and even stress can contribute to this condition. Understanding the causes helps us recognize why symptoms appear and how lifestyle choices can impact acid reflux. Now, let's move on to the early warning signs you should watch for. One of the earliest and most common signs of GERD is heartburn. This is a burning sensation in the chest, often occurring after meals or when lying down. Heartburn can feel like discomfort or pain behind the breastbone and may radiate up toward the neck or throat. It's important to note that occasional heartburn is normal, but frequent episodes may indicate GERD. If you notice this symptom regularly, it's time to pay attention and consider seeking medical advice. Regurgitation is another early warning sign of GERD. This refers to the sensation of acid or food coming back up into the throat or mouth. It can leave a sour or bitter taste and may happen soon after eating. Regurgitation is uncomfortable and can disrupt daily activities. If you experience this symptom, especially alongside heartburn, it's a strong indicator that acid reflux may be present. Difficulty swallowing, also known as dysphagia, can be an early sign of GERD. This symptom occurs when acid irritation causes swelling or narrowing of the esophagus, making it hard to swallow food or liquids. You might feel as though food is stuck or slow to move down. Persistent swallowing issues should not be ignored, as they may signal more advanced GERD or other health concerns. A chronic cough that doesn't seem to go away can be linked to GERD. Acid reflux can irritate the throat and airways, triggering a persistent cough. This symptom often occurs without other respiratory issues and may worsen at night or after meals. If you have a cough that lasts for weeks and isn't related to a cold or allergies, GERD could be the underlying cause. Hoarseness or a sore throat can be an early sign of GERD. Acid reflux irritates the vocal cords and throat, leading to changes in your voice or discomfort. You may notice your voice sounds raspy or you have a persistent sore throat, especially in the morning. These symptoms are often overlooked but can be important clues to underlying acid reflux. Chest pain is a symptom that can be associated with GERD, but it's important to distinguish it from heart-related pain. GERD-related chest pain is usually burning or pressure-like and often occurs after eating or when lying down. If you experience chest pain, especially with other GERD symptoms, it's wise to consult a healthcare provider to rule out heart problems and address acid reflux. Bad breath, or halitosis, can be an early warning sign of GERD. Acid reflux allows stomach contents to reach the mouth, leading to unpleasant odors. If you notice persistent bad breath despite good oral hygiene, it may be related to acid reflux. This symptom is often subtle but can indicate ongoing digestive issues. Feeling nauseous after eating can be an early sign of GERD. Acid reflux can cause discomfort and queasiness, especially after large or fatty meals. If you regularly feel nauseated after eating, it's worth considering GERD as a possible cause. This symptom may be accompanied by other signs like heartburn or regurgitation. Bloating and a feeling of fullness are common early signs of GERD. Acid reflux can slow digestion, leading to abdominal discomfort and a sensation of being overly full. This symptom may occur even after small meals and can make eating unpleasant. If you notice persistent bloating, it's important to monitor for other GERD symptoms. Excessive salivation, or water brash, can be an early sign of GERD. When acid enters the esophagus, the body may produce extra saliva to neutralize it. This can lead to frequent swallowing and a sensation of a wet mouth. If you notice this symptom, especially with other signs of acid reflux, it's worth discussing with your doctor. GERD symptoms often worsen at night or when lying down. Gravity helps keep stomach acid in place during the day, but at night, acid can more easily flow into the esophagus. This can lead to increased heartburn, coughing, and discomfort. If your symptoms are worse at night, it's a strong clue that GERD may be involved. Symptoms of GERD often appear after eating large meals. Overeating increases pressure in the stomach, making acid reflux more likely. If you notice heartburn, regurgitation, or bloating after big meals, it's important to consider GERD as a possible cause. Eating smaller, more frequent meals can help reduce symptoms. Fatty foods can trigger GERD symptoms. These foods slow digestion and relax the lower esophageal sphincter, making acid reflux more likely. If you notice symptoms after eating fried or fatty foods, it's a sign to adjust your diet and watch for GERD. Alcohol can worsen GERD symptoms. It relaxes the lower esophageal sphincter and increases acid production. If you notice heartburn or regurgitation after drinking alcohol, it's a sign to limit intake and monitor for acid reflux. Caffeine, found in coffee, tea, and some sodas, can trigger GERD symptoms. It relaxes the lower esophageal sphincter and stimulates acid production. If you notice heartburn or regurgitation after consuming caffeine, consider reducing intake to help manage symptoms. Spicy foods can irritate the esophagus and trigger GERD symptoms. If you notice heartburn, regurgitation, or discomfort after eating spicy meals, it's a sign to adjust your diet and monitor for acid reflux. Citrus fruits and juices can trigger GERD symptoms due to their acidity. If you notice heartburn or regurgitation after consuming oranges, lemons, or grapefruit, it's a sign to moderate intake and watch for acid reflux. Chocolate can trigger GERD symptoms by relaxing the lower esophageal sphincter and increasing acid production. If you notice heartburn or regurgitation after eating chocolate, it's a sign to limit consumption and watch for acid reflux. Mint, including peppermint and spearmint, can relax the lower esophageal sphincter and trigger GERD symptoms. If you notice heartburn or regurgitation after consuming mint, it's a sign to avoid these foods and monitor for acid reflux. Carbonated drinks can increase stomach pressure and trigger GERD symptoms. If you notice heartburn or regurgitation after drinking soda or sparkling water, it's a sign to reduce intake and watch for acid reflux. Smoking can worsen GERD symptoms by relaxing the lower esophageal sphincter and increasing acid production. If you notice heartburn or regurgitation after smoking, it's a sign to quit and monitor for acid reflux. Stress can trigger GERD symptoms by affecting digestion and increasing acid production. If you notice heartburn or regurgitation during stressful periods, it's a sign to manage stress and monitor for acid reflux. Lying down after eating can worsen GERD symptoms. Without gravity, acid can more easily flow into the esophagus. If you notice heartburn or regurgitation after lying down, it's a sign to avoid this habit and monitor for acid reflux. Strenuous exercise after eating can trigger GERD symptoms. Physical activity increases abdominal pressure, making acid reflux more likely. If you notice heartburn or regurgitation after exercise, it's a sign to adjust timing and monitor for acid reflux. Wearing tight clothes around the waist can increase abdominal pressure and trigger GERD symptoms. If you notice heartburn or regurgitation after wearing tight clothing, it's a sign to choose looser garments and monitor for acid reflux. Pregnancy can trigger GERD symptoms due to increased abdominal pressure and hormonal changes. If you notice heartburn or regurgitation during pregnancy, it's a sign to discuss with your doctor and monitor for acid reflux. Weight gain can increase abdominal pressure and trigger GERD symptoms. If you notice heartburn or regurgitation after gaining weight, it's a sign to consider weight management and monitor for acid reflux. A hiatal hernia can trigger GERD symptoms by allowing stomach acid to flow into the esophagus. If you notice heartburn or regurgitation after being diagnosed with a hiatal hernia, it's a sign to discuss with your doctor and monitor for acid reflux. Certain medications can trigger GERD symptoms by relaxing the lower esophageal sphincter or increasing acid production. If you notice heartburn or regurgitation after starting new medications, it's a sign to discuss with your doctor and monitor for acid reflux. Aging can trigger GERD symptoms as the lower esophageal sphincter weakens over time. If you notice heartburn or regurgitation as you get older, it's a sign to monitor for acid reflux and discuss with your doctor. Eating quickly can trigger GERD symptoms by increasing stomach pressure and reducing digestion time. If you notice heartburn or regurgitation after eating fast, it's a sign to slow down and monitor for acid reflux. Eating late at night can trigger GERD symptoms as digestion slows and acid reflux becomes more likely. If you notice heartburn or regurgitation after late meals, it's a sign to adjust meal timing and monitor for acid reflux. Eating large amounts of food can trigger GERD symptoms by increasing stomach pressure and making acid reflux more likely. If you notice heartburn or regurgitation after overeating, it's a sign to eat smaller portions and monitor for acid reflux. Certain foods, such as onions, garlic, and tomatoes, can trigger GERD symptoms. If you notice heartburn or regurgitation after eating these foods, it's a sign to adjust your diet and monitor for acid reflux. Acidic foods, such as vinegar and pickles, can trigger GERD symptoms. If you notice heartburn or regurgitation after eating acidic foods, it's a sign to moderate intake and monitor for acid reflux. Dairy products can trigger GERD symptoms in some people. If you notice heartburn or regurgitation after consuming milk, cheese, or yogurt, it's a sign to monitor for acid reflux and consider dietary changes. Processed foods can trigger GERD symptoms due to additives and preservatives. If you notice heartburn or regurgitation after eating processed foods, it's a sign to choose whole foods and monitor for acid reflux. Fast food can trigger GERD symptoms due to high fat and additives. If you notice heartburn or regurgitation after eating fast food, it's a sign to limit consumption and monitor for acid reflux. Fried foods can trigger GERD symptoms by increasing stomach pressure and slowing digestion. If you notice heartburn or regurgitation after eating fried foods, it's a sign to limit intake and monitor for acid reflux. Sugary foods can trigger GERD symptoms by increasing acid production and slowing digestion. If you notice heartburn or regurgitation after eating sweets, it's a sign to moderate intake and monitor for acid reflux. Salty foods can trigger GERD symptoms by increasing stomach pressure and irritating the esophagus. If you notice heartburn or regurgitation after eating salty foods, it's a sign to moderate intake and monitor for acid reflux. Hot foods can trigger GERD symptoms by irritating the esophagus and increasing acid production. If you notice heartburn or regurgitation after eating hot foods, it's a sign to moderate intake and monitor for acid reflux. In summary, GERD can present with a variety of early warning signs, from heartburn and regurgitation to cough, sore throat, and dietary triggers. Recognizing these symptoms early is key to preventing complications and improving quality of life. If you notice any of these signs, consider making lifestyle changes and consult a healthcare provider for proper diagnosis and treatment. Early intervention can make a significant difference in managing GERD and maintaining digestive health.